It started as a strange tingling in his toes, almost like tiny ants crawling under his skin. Over time, the sensation spread to his feet, turning into a burning pain that made even walking unbearable. He tried changing shoes, soaking his feet, and even ignored it for months, thinking it would go away, but it didn't. His doctor finally gave it a name: neuropathy. If this story feels familiar, you're not alone. Neuropathy affects millions worldwide, yet it's often misunderstood or misdiagnosed. Today, we're going to break it down. This isn't just about understanding neuropathy, it's about empowering you to take control of your health and find hope in the journey ahead. Hi everyone, welcome to NeuroMonk, your go-to source for health insights that matter. This is Dr. Apaji Rai, and today we're diving into neuropathy, or more specifically, peripheral neuropathy, a condition where the nerves outside your brain and spinal cord are damaged. Think of your nerves as electrical wiring that transmits messages between your brain and the rest of your body. When these wires are damaged, the signals get scrambled, leading to symptoms like pain, numbness, or weakness. There are many types of neuropathy, but the most common one is peripheral neuropathy, which affects the hands, the feet, and legs. It can result from diabetes, the leading cause, often called diabetic neuropathy, infections or autoimmune diseases such as shingles, HIV, or lupus, injuries, trauma that compresses or damages nerves, toxins like alcohol, chemotherapy drugs, or heavy metals also cause neuropathy. Nutritional deficiencies, especially B12, is a common cause. It's important to note that neuropathy isn't a disease itself. It's a symptom of an underlying condition. Understanding this is the first step towards finding the right treatment and reclaiming your quality of life. Neuropathy symptoms vary depending on which nerves are affected: sensory, motor, or autonomic. Here's what to look for. Sensory nerve damage, which is most common, presents as tingling or pins and needle-like sensation, burning, stabbing, or shooting pain, loss of sensation, which might make it hard to feel temperature or pain. Heightened sensitivity, something as light as a bedsheet, can feel painful. Motor nerve damage, muscle weakness or cramps, difficulty walking or holding objects can happen. Autonomic nerve damage, issues with sweating, blood pressure, or digestion, dizziness when standing up, also called orthostatic hypotension, can also be seen. These symptoms often start in the feet or hands and gradually move upward, a pattern known as stocking and glove distribution. If you're noticing any of these symptoms, it's essential to see a doctor. Early diagnosis can make all the difference. If you or a loved one suspects neuropathy, here's what you can do. Seek medical evaluation. A neurologist will perform a detailed history, physical examination, and may recommend tests like blood tests or imaging studies and nerve conduction studies. Identify the underlying cause. Neuropathy is often a symptom of a broader issue like diabetes, an autoimmune condition, or vitamin deficiency. Treating the root cause is the key. Start early treatment. The sooner neuropathy is addressed, the better the chances of slowing or even reversing the damage. Remember, you're not alone in this journey. Help is available, and taking that first step can lead to meaningful change. While neuropathy can be a lifelong condition, there are many ways to manage it and improve quality of life. Medications. Pain relievers, though overuse is not recommended. Antidepressants or anticonvulsant medications like gabapentin or amitriptyline can help to calm the nerve pain. Topical treatments such as caspacin cream or lidocaine patches also help. Lifestyle changes. Manage underlying conditions like diabetes, quit smoking, and limit alcohol. Eat a healthy diet rich in B vitamins, omega 3s, and antioxidants to support nerve health. Exercise regularly with low impact activities like walking or swimming to improve blood flow and reduce pain. Alternative therapies: physical therapy to improve strength and mobility, acupuncture or massage for temporary pain relief, nerve stimulation devices like TENS units to block pain signals. These strategies aren't just about managing symptoms, they're about reclaiming your life and finding joy in everyday moments. Living with neuropathy can be emotionally and physically challenging, but you don't have to face it alone. Support groups, connecting with others who understand what you're going through, can be incredibly validating. Mental health care. Chronic pain can lead to depression or anxiety, so don't hesitate to seek counseling or therapy. Practical adjustments. Use protective footwear to prevent injuries if you lost sensation in your feet, and consider assistive devices like canes or braces for balance issues. Remember, living well with neuropathy is about addressing the physical, emotional, and social aspects of the condition. You're not just surviving, you're thriving one step at a time. Exciting advances are happening in neuropathy research. Some promising areas include regenerative medicine using stem cells to repair damaged nerves, gene therapy targeting genetic causes of certain neuropathy, new medications, developing drugs that specifically target nerve regeneration or pain pathways are in progress. These breakthroughs bring hope for better treatments and one day, even a cure. While the journey with neuropathy can be challenging, the future is bright and science is on your side. Neuropathy may feel like an overwhelming diagnosis, but knowledge is power. Understanding the condition and its causes can open the door to better management and improve quality of life. If you found today's episode helpful, share it with someone who might benefit. Together, we can raise awareness and support those affected by neuropathy. Thank you for tuning in to Neuromonk. If you have any questions or suggestions for future topics, feel free to reach out. Take care and remember, every step forward is a step towards healing.